Hello and welcome to today's program. I am Ogechuku Ukegwe. The Minister of State for Water Resources and Sanitation, Bello Goronyo, has urged Nigerians to practice hand hygiene, which plays a key role in safeguarding public health. He made this call in Abuja at a news briefing to commemorate the Global Hand Washing Day campaign 2024 with the theme Why Are Hands Still Important? The event was organized by Self-Help Africa, an international organization in partnership with the Federal Ministry of Youth Development, National Youth Corps Service, Foreign Commonwealth Development Office, amongst others. Goronyo, represented by the Director of Water Supply, Babarinde Mokaila, said that the ministry is committed to strengthening wash infrastructure and policy implementation. The Kano state government has reaffirmed its commitment to ensuring all eligible children receive immunization through targeted program while improving healthcare service delivery in the state. The Commissioner Abubakar Yusuf gave this reassurance during a briefing in Kano to commemorate the 2024 World Polio Day held on 24th October 2024. Abubakar also lauded efforts of the state governor Abba Yusuf for his intervention and projects in the state health sector, which culminated in keeping it polio-free from world polio virus. He, however, acknowledged the need to remain as account for 26% burden of polio virus type 2. Let's take a short break and the program will return. Stay with us. Welcome back. Experts say polio is a highly infectious viral disease caused by poliovirus. It is primarily affects children under 5 but can also impact unvaccinated adults. Many individuals infected with polio do not show symptoms. However, about 1 in 4 many experience flu-like signs such as fever, fatigue, headache, vomiting, and neck stiffness. In severe cases, the virus can attack the nervous system, leading to paralysis, which can be life-threatening. Since the launch of the Global Polio Eradication Initiative in 1988, polio cases have decreased by over 99%. However, the disease has not been eradicated entirely, with outbreaks still occurring in some regions, particularly in parts of Africa and South Asia. Currently, polio is endemic in only a few countries. Ongoing vaccination efforts and surveillance are crucial to preventing the resurgence of the disease and achieving global eradication. While significant progress has been made in the fight against polio, continued efforts are essential to eliminate the virus completely and protect future generations from the disease. Well, joining me on the program to discuss further is Oluwakemi Oshodi, a state immunization officer with the Primary Healthcare Board, Lagos State. So polio is a highly infectious disease. What would you say are the main symptoms and how can they vary among individuals?
Thank you. Thank you for having me on the program. So polio is characterized, or the symptoms of polio are as follows. Fever, we have headache, we have stiffness of the neck, we have sore throat, we have vomiting. We also have diarrhea or constipation, and then we also have back pain. There could also be associated weakness of the limbs and the upper and lower limbs, or in some cases both of the upper and the lower limbs, and also we can have severe symptoms like paralysis. We also could have loss of reflexes, and then it varies in persons. Some people are asymptomatic. At least about 72% of individuals that come in contact with the polio virus are asymptomatic. But for those that are symptomatic, they come down with these listed symptoms. Thank you.
So how is the polio transmitted and what measures can be taken to prevent further spread?
Okay, so polio is transmitted through fecal-oral routes, and it can also be transmitted from person to person. Through the fecal-oral route, from the feces of an infected person to the mouth, probably of a child that is under 5 years, basically, because those are the most susceptible children and persons that can get affected with polio virus. And then from person to person, getting in contact with the feces or mucus or of a person that is already infected. Also, for another another transmission way is through the contaminated food and water. So how it can be prevented through vaccination. If a child is vaccinated with IPV, or that's an inactivated polio virus vaccine, and or OPV, that's the oral polio vaccine, they can be prevent. They can prevent. This can prevent against the polio virus. Also, hygiene, hand wash. We also with soap and water. We have proper toilet hygiene. Then, if there's access to clean water, and then if there's also effective waste management, these are the measures whereby polio transmission can be reduced in our communities. Thank you.
So you mentioned the IPV and the OPV. Can you explain the differences between these two?
Okay, so IPV is inactivated, and when I say inactivated, it's a killed vaccine. The virus is killed and then introduced, and it gives humoral immunity, and it gives so it is injected. It is an injectable, however, and it gives a lifetime immunity. However, OPV is oral, and it's given orally. It is the weakened virus is introduced into the body, and then when the body sees this virus, it fights against it. When it sees this virus, it builds immunity against this virus, and then when it sees this virus in the future, it fights against this virus. So these are the differences, and then they both give lifetime immunity. For IPV in Nigeria, it is given twice at 6 weeks and at 14 weeks. However, OPV is given 4 times, and that is at birth between 0 to 2 weeks, and at 6 weeks, at 10 weeks, and at 14 weeks in Nigeria immunization calendar.
Okay, so how do environmental factors influence the transmission of polio?
Okay, so environmental factors that influence the transmission of polio are poor sanitation and then the living conditions. Most, like I said, polio can be transmitted from person to person. So our living condition in our communities, especially in places where we have the urban slum communities, you know how the living condition is there. Then we also have poor waste management. If there's proper waste management, because we have been able to at some point say that yes, Africa is free of polio. However, we have environmental samples collected, and we still have strains of polio virus seen in these environmental samples. So if there's proper waste management, we would be able to say that we can be totally free of the wild polio virus. And then there's also contaminated water sources. There's lack of proper toilet facility. There's also inadequate vaccination coverage. I mean, most of the children in these communities or in this country and beyond also do not, or their guardians or parents do not take them for vaccination due to one reason or the other. So for inadequate waste management, if we have proper waste disposal, and like I said, it can be transmitted from person to person. So if there's proper waste management and proper toilet facilities in our communities, we would be able to reduce the burden of polio virus in our communities and in our country as a whole. There's also inadequate vaccination coverage. Some children are like 95% of our children under 5 are supposed to be vaccinated, at least 95% against the polio virus in order for us to have a herd immunity. However, we see that that's not the case, as we have defaulters around, pockets of defaulters around in the community, and the caregivers are not taking the children for vaccination exercises, especially during or after the COVID pandemic in 2020. Most of our vaccination coverages have gone down, and we are also having pockets of outbreaks here and there. So if all these are in place, we would be able to properly and effectively eradicate polio. And these are the environmental reasons, or environmental reasons for polio outbreaks that promotes polio virus in our communities. Thank you.
Okay. So how has the incidence of polio changed over the past few decades?
Okay, so since the global polio eradication initiative in 1988, we've had significant polio eradication in for the America. We have polio eradication certification in 1994. In the European continent, we had in 2002, and in the South Asia, we had in 2014, and in Nigeria, as a country, we were certified wild polio free in 2020 rather, pardon me. And so gradually we are attaining polio eradication globally. However, we still have outbreaks in some countries like Afghanistan and Pakistan. These are places where we have the war ongoing. So we have war. We've had wars, and then we've had also polio. We've had polio outbreaks, and we've had rejections with polio vaccination.
What's the significance of herd immunity in the context of polio vaccination?
Okay, I've defined herd immunity. Herd immunity is a sufficient percent, is when a sufficient percentage of a population is immunized and protected, and so they are protecting those that are not immunized due to maybe a weakened immune system, maybe because they are immunocompromised and they could not get the vaccine, or at some point they could not get the vaccine, maybe due to defaulting. So the herd immunity, if we have a herd immunity, about 95%, as I said, for polio vaccinated, they would protect those that have not been vaccinated. And significantly, for polio, it breaks the chain of the polio virus transmission and reduces the number of susceptible individuals that could come down with the polio virus.
Are there any long-term effects for those who have recovered from polio?
Yes, unfortunately, there are long-term effects for those who have recovered from polio. This can happen between 15 to 40 years after the initial infection. It could come down with the severe symptoms of the polio virus. It could be muscle spasm. There could be there could be muscle spasm. It could affect the respiratory system. It can affect. There could be difficulty in breathing and difficulty in swallowing, and then there could also be vision problems. There could also be cognitive impairments for those that would probably experience the post-polio syndrome later in the years. And that, as I said, between 15 to 40 years later, they could come down with these symptoms of polio that they did not get while years back when they recovered.
So how can parents ensure their children are adequately vaccinated against the polio virus?
Okay, so I think first of all, as a community or as a country, we need to sensitize the parents on the benefits of getting their children vaccinated. And then secondly, getting sensitization helps them to understand the need for vaccination. And then when they understand the need for vaccination for their children and the benefits for the vaccination for these children, they would really take their children to the health facilities to get them vaccinated. That's one. So we also have community outreach services. They would also, when our people go into their community, stay in strategic places and vaccinate children, eligible children. So for mothers, caregivers, they are encouraged to go to either the primary healthcare facilities, the secondary healthcare facilities, and also some of our tertiary, but also the tertiary health facilities. They all offer vaccination activities, or vaccination services rather, and parents are encouraged to go to these health facilities to get their children vaccinated. Or they could also get their children vaccinated in the community during outreach services.
What role do surveillance and outbreak response play in polio eradication efforts?
Surveillance. Okay, so for surveillance, I would say that there is monitoring and supervision for polio cases or suspected polio cases. There's also the need for investigating acute flaccid paralysis cases reported. There's also confirmation of polio cases through lab testing. That's when I say they have to do investigation of any polio case reported. There's also tracking of polio transmission, and then also there's continuous sewage sampling, environmental sampling of the sewage to identify if there are polio strains in the sewage samples collected. Also, there's also enhanced vaccination activities, and also there should also be investigations done for contact tracing. And I mean, if you have an outbreak in a community, you should also trace the contacts that this infected person has been with.
What would you say are the most common misconceptions about polio and its vaccination?
Okay, I think when it comes to misconception, in our African culture, we have misconception about basically everything. Our culture comes into place, our tradition comes into place. We all believe that there's one thing or the other wrong with whatever has been brought into the country. So for us, there's people think that polio is a disease of the past. Some people think that it affects only children, and like I said, people also come down with post polio syndrome years later. So for people, some people think it is not contagious, and some people think even the oral polio vaccine causes polio, and then some people think that multiple doses of the polio vaccine would also be harmful to their children. However, this is not the case. All these are not proven scientifically, and polio vaccine is safe, it is effective, and it is available free for everyone. Thank you.
What populations would you say are most at risk for polio today, and why?
Okay, the population that are most at risk are children under 5 years because they have immature immune system. We also have the pregnant women, and because I mean, when you're pregnant, you probably at some point have a weakened immune system. And then for immunocompromised individuals like those that have HIV, cancer, and maybe AIDS. And then for migrant travelers, we have people coming from polio endemic areas to polio free areas. These are the people that are most at risk of this polio virus.
How
Are the
effective
current
are the current
vaccination.
vaccines in providing long-term immunity against polio? Briefly.
Okay, so like I said, we have two vaccines, IPV and OPV, and they are very effective against preventing poliovirus, and they have long-term or lifetime protection for individuals who have received the poliovirus vaccine, and they are very safe. In addition, we have an ongoing campaign in the state, and that's called the Integrated Supplemental Immunization Activity, whereby we are vaccinating children 9 months to 59 months against the measles vaccine, virus. We are vaccinating people 9 months to 44 years against the yellow fever virus. Also, we are giving girls, our female children, 9 years to 14 years, the human papilloma virus vaccine. For those that missed it last year when we introduced the human papillomavirus vaccine, it is now available, and personnel are going about in the community to administer this vaccine. Also, it is available in our primary healthcare centers, the general hospitals, and the tertiary health facilities.
Okay, sorry,
And
because of time, we'll have to cut you
military and
short.
paramilitary.
Sorry, we are running out of time.
Okay.
Oluwakemi Oshodi, a state immunization officer. Thank you for lending your thoughts on the program. And that brings us to the end of today's program. Thank you for watching. See you next time.